Hello and welcome, everyone. I'm Dr. Lianov. I'm the president and founder of the Global Positive Health Institute, and this is our GPHI podcast where we have our guests talk about positive psychology, positive health, and the link with lifestyle medicine. And today I'm delighted to have with us Dr. Marta Bassi, as she's the immediate past president of the European Network for Positive Psychology, and she's an associate professor and medical faculty at the University of Milano. So she teaches general psychology, teaches doctor-patient communication, and we just recently were at the European Conference of Positive Psychology where we presented together at a positive health symposium, which was delightful as we're advancing this field of positive health. So welcome, Dr. Bassi.
Thank you so much, Liana, and thank you for inviting me, following up on the fantastic symposium we had at Innsbruck at the conference, the ENPP conference. And we managed to build a team, Liana managed to build a team of different researchers focused on positive health and how crucial it is for people's well-being. Thank you so much.
Well, thank you. And thank you for joining our podcast. So I want to dig in to hear more about you and how you got involved in positive psychology and how you're using it. So what grabbed your attention to this field? How did you get interested and how did that develop?
Well, that's a long story. It actually started before positive psychology started. Because I was a student back in the day. I'm not a physician. I'm a psychologist, but I also have a degree in foreign literatures, so foreign languages, English and German. And back in the days, I was studying languages, and I took a course in psychology just to, curious about it. And I happened to find my mentors there, and the person I'm still collaborating with, that is Professor Fausto Massimini and Professor Antonella Delle Fave, and they were researching on flow. So optimal experience, it's one of the core concepts in positive psychology nowadays. And back in the days, it was like, some fringe ideas, especially in my home country, Italy, some fringe ideas that had nothing to do with real people's problem, but things that could help people thrive. So they were not that appealing or interesting. And all of a sudden, when positive psychology developed in 2000 with Professor Csikszentmihalyi and Professor Seligman as the people in the forefront, then I also got into positive psychology as an official movement. But what really triggered my attention was the idea and the concept of flow and the concept of this particular experience where you're extremely focused and concentrating on what you're doing. And by being so concentrated, you get united with the activity you're performing. You don't look at yourself, you don't self-observe yourself, you're not aware of yourself, but you're flowing with the activity. And I found there were so many activities that led me to this. I also worked for a while as an interpreter, as a simultaneous translator, and that was the one of my flow experiences. So that's how it all started, meeting them and then turning into a well-established movement. And after that, I managed to get involved in the network of positive psychology in Europe. We organized the second European conference in Palanza in 2004. So that's been a long ride till nowadays, where I then landed into the medical faculty, and I try to use these concepts for the well-being of people, which sounds like a weird concept sometimes to both patients and their families as well as doctors.
Wonderful. And flow is a a very important element of the tools in our toolkit that we have in positive psychology, and I call it kind of a mindfulness, and so that's great that there's more work being done in this area to really meld it in medicine and healthcare as well. In other words, to see if we can have that as a tool, not just in psychology, but in healthcare to help our patients, especially patients that are experiencing a lot of stress and are looking for some solutions. So that's wonderful. And before we dive more into the professional part of what you're doing with these topics, can you share a little bit about how you use this personally, and what's your favorite way to apply positive psychology for your own well-being?
Oh, well, let's say I am not that good in practicing because life is kind of stressful at the moment. But I do have some let's say happy rules I try to observe. First one is it's very in line with lifestyle medicine and positive psychology. So one is I try to sleep as healthy as long as possible. So when I come home, there's no way I'm going to be distracted. Just focus on what I need to do in the house and then have a good night's sleep. And then I think the other area I really practice is physical exercise. I like it very much, and I walk a lot in the neighborhoods, in the parks, and I try to do it also in to take outings and travels ahead in other countries to do that. Like I'm currently in Iceland, and it's just amazing to walk in the woods here and to meet like I just saw a huge uh, rabbit yesterday that was really huge. So anyway, and so that's also the wonder and the aesthetic encounter with nature, I would say. And then yeah, and try to practice flow in my life. As said before, I have loads of activities in which I can find flow and just lose myself. What reading and studying and learning, of course, that's also my job, so I'm lucky with that. But I also like to practice that sounds maybe a bit weird. Rock recording, rock art recording. So there is a place up in the mountains that it's a UNESCO site, very close to to Milano, northern Italy, where I live, and there are rock carvings um, of the prehistoric times, and I just go there on the rock and record with a group, of course, of experts, and I record the carvings, and that's also extremely flow inducing because one of the key element for flow to possibly arise is find a challenge that is uh, matched with your skills at that particular time. So I started slowly. I started with very little skills, but that was extremely challenging. That captured my enthusiasm, my attention, and my effort into the activity. And then I kept doing and doing it again in very weird positions, also on rocks, perching or something. And then I increased my skills and I went for higher challenges. And this is also one of the trigger we talked about during the symposium that you organized about flow in health. So maybe I can, if you like, I can spend a couple of words on that. How
Sure, sure, go ahead.
flow can be, I think, a motivational driver in health in multiple ways. Like in the first, I was talking about this challenges skills balance that help you go into the particular motivating state, which is driven by the activity and, of course, the meaning and the importance give to that activity. And so, in doing this, you can also, let's say, um, associate this kind of experience with activities that are good for your health, and it becomes a driver to make you continue that activity. That is one of the main thing that physicians struggle with. They give a prescription and they ask the person to, in rehabilitation, physical or whatever kind of a rehabilitation, they want the person to continue the and practice, and all of a sudden they don't. And of course, it's, let's say, it depends on a lot of variables, but finding flow and attaching meaning and making it a self-reproducing system helps in maintaining over time a good practice. That could be a health practice, like me, rock recording, or yeah, also uh, physical activities or any other uh, physical practice that is necessary, or treatment requirement that makes sense and is accessible to your skills, and a challenge to some higher goals that obviously is related to health, but not necessarily to health, also to what you think is important for your life. Like to be healthy, not just for health per se, but maybe if you're an elderly, because you can have more time, you can spend more time with your grandchildren, you're more flexible and following them in some outdoors activities. So that makes sense. And you keep doing it. And by doing that, you have a lot of very nice side effects.
Yeah,
So
great job of describing this. This is the heart of what also really engaged me in the field of positive psychology, is how it links to behaviors and this the upward spiral of behavior change when you link behaviors with these positive experiences, meaning, flow, positive emotions. So absolutely, I agree that that is a very important kernel that we can really hopefully springboard off of that to use positive psychology and advance positive health for our patients and for ourselves, is to connect those positive experiences with behaviors. And before we go on, because I want to again learn more about how you use that with the students, but let's go back a little bit. Your this hobby that you have, which I'm not familiar with, and maybe our viewers are not familiar with this rock recording. Tell us a little bit more about that.
I have pictures. I can send them privately to you. It is something you put the plastic layers, foils, sheets on the rock that is, or carved. It's usually carved with the tiny, back in the past, with the tiny stone, or in the Iron Age, of course, with iron tools. And you put the piece of plastic on top of it, and you have to reproduce what has been done with a little hammer.
Mm.
So you fix it, you trace the tracks, the cracks of the rocks first, and then you go with a pen, a black pen, and you just reproduce what's been done, which sounds easy, but it's not easy in the least. So that also implies sometimes you go there during night with a huge torch so that you can project the light on the rock, and basically the grooves stand out, right? So
Yeah.
that just you see it three-dimensional, and then you do it again during the day. And the reason why you do that, because in the past the way to record it was to use a special fluid that also include white fluid that also included milk and some other chalks, or but I'm not really sure about what the material was, but it was shown to ruin the rock. So you're not now allowed to touch the rock per se. You only have to reproduce it. You can also take scans and pictures, 3D pictures. That's also possible. But the good thing is to do it by hand and by learning. And yeah, that's super concentrating, but because you have to do it, you slow down, and you just are a unison with your body and with the rock. And funny enough, I've become, let's say, relatively good, or at least not as bad. And there are groups of people from all over the world coming over. Some of them are archaeologists in training, but there are also other persons like with uh, that they want to spend a summertime, and there was that that was before COVID. There was a university student, young one, who had autism syndrome, and he just loved it. That was an activity he was very good at, and he was praised for this. And he would be in nature, he would be with other people around him because you're not alone. So that was a fantastic experience, not just to be able to record, but also to share with other people in the group.
Wonderful. Well, thank you for enlightening us about this very unique hobby that I was not familiar with. So, thank you. Um, well, let's go back to our discussion about positive psychology, positive health, and healthcare and medicine. So, you're teaching medical students, and right before this podcast, we were chatting about that. So, how are you using this topic and exposing future generations? Uh, Physicians to this important topic.
Yeah, well, as you mentioned, we were talking about how difficult it is to do it. It is difficult. Well, first thing, I teach third year, so it's still preclinical. And in Italy, they do not get to see and to go to the wards up till the second semester of the third year. So it's a challenge for me and my colleagues, of course, to get into explaining that, first of all, it's not just parts of the body of the person, but it's a person, and that person is not functioning well on some areas, but could be functioning well in other areas. And knowing what areas are functioning well can help you also in dealing with the non-functional ones, especially when you have uh, situations of persons with chronic diseases, in which, of course, you can kind of limit or slow down the progress of the disease, but you cannot stop it. And the person has to be seen in, of course, as a whole, in the whole picture, but also as what is functioning well or not functioning so well in the positive, let's say, continuum of health. That is absolutely crucial. And what I do, for example, with my students is I kind of use like a parallel chart, like in narrative medicine, that they can fill out. Um, Very simple. There's no, and that's also a challenge because students, doctor students, love protocols, and I don't give them protocols, so that's quite destabilizing. And I just put some areas like perception, like typical themes of general psychology: perception, motivation, behavior, and learning, emotions. And I ask them, based on the course, to pose questions to patients or persons they know that have a disease, and to figure out what is not going well and what is going well. And so to cross the two fields, like how can you then join the two areas, and at the end the overall um, knowledge about what the person is like and what the person's life is like, because lifestyle is about life. So what happens on their daily basis, and you have to ask them. And funny enough, some of the students say, but I feel like intruding in a person's life, like asking more personal questions about their life. And and then and then I said, but yeah, but how did the patient react from you asking? And once a student, the patient, him or herself, has the personal script on how to behave under those circumstances, right? So they kind of find it suspicious, like, why are you asking me that? And then if the answer is like, because I want to know you better, I want to understand better how to contextualize the treatment or the situation in your life, it just, the alliance between doctor and patient just spirals up
Yeah.
because the patient, him or herself, understands the interest of the doctor and the reason why the question is asked, and things from that point on just go much smoother than before. That's the impression, and not only for the patient, of course, but also for this the student and would-be doctor, because they have grounds to, to be, to also to not just, it's not on a par level. It's like it's on a par level in terms of understanding each other and trust.
Mhm.
That can, you know, ease the process. That's what I try to tell them on the positive aspects, and also talking about flow, asking like out of the blue questions like, okay, you're here because you have, this and this parameter of your blood pressure and this whatever analysis or exams, evaluations, but then ask something about, the positive. So like, is there like a person, I've worked a lot with persons with multiple sclerosis. One question would be not just how depressed you are because of, of the situation, or I don't know how to say that in English, the myelin sheath
Yeah. Mhm.
depletion. Um, and so that's why you're also more fatigued and that. But what are the areas in which you feel less fatigue, or you feel like engaging in the long term? Is there an activity you can put your skills into, and that's challenging enough that you really want to do it? So just switching the prospect, or at least complementing, because that's not like choosing between one or the other, is to complement and
Yeah.
to join both. So yeah.
Yeah. That's wonderful, because what you're describing is that positive interaction between the student, future doctor, and the patient, that is contributing to the well-being, right? Those micro moments of positivity that Barbara Fredrickson talks about, that contributes to the well-being of both individuals involved. So there's that, plus the wonderful part about positive psychology is looking at life's difficulties through a lens of, okay, there are things that are going wrong, but there must be something that's going right. And let's build on that. Let's seek that out and build on that in order to empower ourselves to take care of what's gone wrong. And then oftentimes I'll take that the next level, because sometimes people say, they raise their hand, well, what if everything's gone wrong? There's nothing, okay, which usually is not the case, but let's say everything's gone wrong. Well, then, of course, in positive psychology, we have to look inward to our own strengths, and especially areas of character strengths as well. And not only what we naturally carry, but then what we can do. And that's what you're
Yeah.
describing in terms of flow experiences. So something we can
Yeah.
actively do despite our difficult environment, that will engage us and boost our well-being, hormonally, as well as in the parasympathetic nervous system, and
Yeah.
calming us down, lowering our blood pressure, our blood sugars,
Yeah.
cortisol, all those wonderful physiologic benefits.
But I want to add on this, because what if everything is going wrong? That's a good question, and that raises two other issues. I think one is process. I mean, it's a dynamic process over time. Like if you just got a diagnosis of, let's say, multiple sclerosis, everything sounds really bad. I mean, that's like a tsunami hitting you. So it's definitely not the best moment, I would say, to start. And it takes each step over time. You learn by by living, by experiences, also your disease. So it may not be the right moment to to go into that. That's more the moment of, elaborating the morning, of how to process the morning, and to go through that. So that's not the best moment to talk about positivity. Like what we did, for example, and that's also like part of the benefit finding literature, also on disease. So yeah, so like we ran a study years ago among women with breast cancer that had been operated on, and it's been some time after the breast cancer. Some have been, let's say, stabilized, so they were not having any recurrent. I don't know the word, sorry, in English, but they were stabilized, so there was, let's say, sort of okay. And then we asked what was good was there anything positive and in your disease and what you went through. And of course, again, most of the time the first gut feeling is like, what are you talking about, are you kidding? But then it starts a thinking process that also tries to find out what's good in what was bad, and that is also extremely important. And the other thing, besides the process of the time frame of disease, is like the different different continua between illness and well-being or wellness, meaning that the fact that everything is going wrong on both continua. I mean, it's not just one, it's two. So if you don't have meaning, if you are not flourishing, if you don't have positive emotions, etc., that does not, I mean, that touches a different area that has to be handled uh, parallel with the other one.
Yeah.
So there's, yeah, so I think that's intriguing, that makes, again, I'm not a doctor, but our profession and also a doctor's profession more exciting and more complex and more rewarding, uh, because it's not just a tiny little bit of a problem. It's a major problem or major challenge that you can face with the patient.
Yeah, and what you're describing also on this two continuum, or really, it's the full spectrum of stepping back. And I have a slide I often show that we have the illness continuum, and that's our primary job, is to move our patients from mental illness, physical illness, to mental health and physical health. But that is not the same thing as the positive health continuum, where we're really bringing them from that languishing, stress, trauma, loneliness, diseases of despair, to becoming their best selves. And so we need to be thinking about both for everyone, and that's an additional challenge for medicine, because medicine hasn't traditionally been thinking about this, but the two continua affect each other. So it's important to think about it. And also, though, it just makes our relationship with our patients and what we do in medicine more meaningful and more exciting. We're bringing people, well, ultimately it's about joy and encompassing the best from life and thriving,
Yeah,
and all those
yeah,
wonderful words we use in positive
yeah,
psychology.
yeah, yeah. I was once interviewing a person for a study on flow and mental health. A person with I'm thinking about the English name. I think it's quadriplegia. You call it? We call it
Quadriplegia,
tetraplegic.
yes.
Yeah, quadriplegia. And that person, the question was, about flow activities. They're open-ended questions that were run like an interview. And that person was saying, uh, how, talking about his life, and said, "Well, I'm thriving at the moment. I have a good job. I have a wife. I have children." And he worked in a factory of his wife's father. So it's father-in-law, I think. Yeah, it's father-in-law, who ran a bakery, a wholesale bakery, so a big company, and he was an accountant there, and he loved it. Everything went well. He didn't see, yeah, of course he couldn't use what, I don't remember whether it was the left or the right hand properly, and we know all the physical issues connected with quadriplegia. But he said, well, I'm just happy. And if you compare, so that's the mental health and the well-being side of his life with living with quadriplegia. And there are other people who don't live with quadriplegia and who cannot say that they are just as thriving in well-being terms.
Yeah,
That's
yeah,
quite
yeah.
interesting. Sometimes, like we've also seen with COVID, you realize more what really matters, both physically and mentally, when you risk of losing it.
Yes.
It sounds taken for granted, but sometimes it's good to be reminded of that.
Yeah, there's actually a wonderful exercise about that elimination exercise to think about some things in your life and what your life would be like without those things, and all of a sudden you start to really appreciate them, and it helps us from taking those things for granted. So
Yeah.
that's great. Well, we're running out of time here, and I have just a couple more questions before we close. I always like to ask, what are some of your favorite positive psychology resources, or lifestyle medicine, positive health, in any of those arenas? What do you turn to?
Okay, for the students are prefer Italian, so we some years ago, Antonella Delle Fave and myself, we wrote a book on health psychology that includes positive psychology. But I finally got hold of your books, and I really love them, and I think that they should be translated into Italian and other languages for students who are not that fluent in English. I think they are very exhaustive, very deep, and both theoretically and scientifically sound, with a lot of exercises, and that's what we're talking about students like most. Yeah,
Yeah.
I think,
Well, thank you.
yeah,
Thank you for that
that's what I
plug.
would say.
I
Yeah,
appreciate it.
no,
And we'll
I
talk
really,
about
so
getting that translated. Um,
yeah.
eh, and then as we close, what is the one takeaway message that you'd like our listeners to remember from our conversation about the key aspects of well-being? What's a one important message to recall?
Well, I would say, well, I'm a flow person, so I would say slow down, concentrate, take your time to invest in the activity you like most, and that will be well-being generating.
I love it. I love those flow experiences. Well, thank you so much for joining the GPHI podcast, Marta Bassi. And thank you to our listeners for chiming in and listening. And I hope you continue to engage with us. We love your feedback, and would love to bring you more of these podcasts. Or if you have suggestions for other guests we can bring on board, please subscribe to our channel, and we'll see you on another one of these. And in the meantime, be safe, be well, and be happy. Take care, everybody. Bye bye.